Welcome to the second module in our Medi-Cal Managed Care 101 series. This series is designed for organizations like yours that are either considering becoming an enhanced care management or a community supports provider, or maybe you're a newly contracted provider just getting started. In this quick video, we'll give you a high-level overview of what Medi-Cal Managed Care is and why so many community-based organizations and others are now contracting with plans as part of Medi-Cal Transformation. Did you know that about 1/3 of Californians have Medi-Cal as their health insurance? And most of them access it through a Medi-Cal Managed Care plan. Medi-Cal Managed Care is all about providing high-quality, accessible, and cost-effective healthcare through organizations and systems that streamline care delivery. But it hasn't always been this way. For decades, Medi-Cal operated on a fee-for-service system. That meant enrollees could see any provider who accepted Medi-Cal, and providers got reimbursed for each service or visit. Now, the state has been shifting to a risk-based managed care system. Under this model, the state contracts with health plans to deliver Medi-Cal benefits in exchange for a monthly payment for each individual. This transformation from a piecemeal system to one that's more streamlined, coordinated, and accountable has included major initiatives like CalAIM, now known as Medi-Cal Transformation, which is broadly reforming Medi-Cal's programs and systems. Understandably, this kind of system shift takes years to fully implement. Because of this, some online Medi-Cal Transformation and CalAIM resources, even from trusted sources like state websites, foundations, or managed care plans, might be a bit outdated or include information that has since changed over time. It's still helpful to review those materials, but keep in mind that if things aren't lining up exactly, it might be because the program is evolving and improving. Information that was accurate just a year or two ago may already be outdated. Also, each managed care plan might have its own unique systems, requirements, and processes for ECM and community supports. So your best bet is to work directly with the managed care plan in your service area to ensure you're working with the most current and relevant information. The California Department of Healthcare Services contracts with a variety of health plans to deliver healthcare services through networks of organized systems that focus on primary and preventive care. These health plans are what we call managed care plans, or MCPs. The Department of Healthcare Services shares oversight of these Medi-Cal Managed Care plans with the Department of Managed Healthcare. Today, about 15.2 million Medi-Cal beneficiaries across all 58 counties receive their healthcare through 5 main models of managed care. If you're curious and want to dive deeper into these models, we've included a link to an explainer on the 5 models. But here's the bottom line. If your organization wants to provide services to Medi-Cal enrollees, you'll need to be part of a managed care plan's provider network. And depending on which county you serve, you might need to contract with up to 5 different managed care plans in that county. Beyond the shift from fee-for-service to managed care, there's another major change happening within Medi-Cal Managed Care. Historically, states couldn't use federal Medicaid funds to pay for non-medical services like housing and food. Because of this, managed care plan networks were made up entirely of traditional providers. Think physicians and hospitals. But things have changed. States like California are now taking advantage of special waivers that allow certain non-clinical services to be included in the Medicaid benefit package. This includes services like case management, housing supports, employment supports, and peer support services. Thanks to these changes, non-traditional providers like social services and community-based organizations can now join managed care plan networks. This means they can deliver care to Medi-Cal members and get paid for it. Today, Medi-Cal provider types include these that you see on screen here, but are not limited to these. To wrap things up, Medi-Cal is on a mission to build a more coordinated, person-centered, and equitable health system that works for everyone. Achieving this goal requires a diverse set of non-traditional providers. If you're watching this series, chances are you're exploring the opportunity for your organization to become a managed care plan contracted provider for enhanced care management or community supports. Here's the big picture. If your organization can provide access to a single lead care manager who offers comprehensive care management, you might be a great fit as an enhanced care management provider. Or if your organization can help address people's health-related social needs, support them in living healthier lives, and help them avoid higher, costlier levels of care, whether it's through helping them secure and maintain housing, providing medically tailored meals for short-term recovery, offering home modifications, asthma remediation, or other community-based services, you could be a perfect fit as a community supports provider. This bold transformation of Medi-Cal requires the commitment of a broad network of partners, including health plans, traditional providers, and now community-based organizations like yours. We encourage you to keep watching the rest of these videos and join the movement. We hope this video gave you a bit more context on what Medi-Cal Managed Care is and the direction it's heading in. If you have a few more minutes, take a look at a couple of spotlights on how enhanced care management and community supports are partnering with Medi-Cal Managed Care. These examples will help you better understand how these new providers are working together to support the health of our communities. The links are in the description. Thanks for joining, and please watch the next video in the series to learn about which Medi-Cal members are eligible to receive ECM and community support services.